You've worked on the front line in the NHS, so what could be done better?
Well, I think one thing that could be done a little bit better is really trying to develop a system from the ground level up. So kind of engaging more with patients and getting their opinions through kind of improved feedback systems, whether that's prompting more patients to go to patient opinion UK websites, or more kind of feedback in ways that staff can channel that feedback. And so it can be used to input into higher up and kind of feedback into practice to change things.
Okay. Julie, what could be done better?
I think we can take a step further back from that and make sure that the public actually know all the professions that work within the NHS. So, for instance, I've got AHP written on this badge here, which I'm sure most people don't understand what that means. It's an all-encompassing phrase which covers everybody else really who's clinical but not a doctor or a nurse. And I think to get the best people in the NHS who are going to be the best at delivering services to patients, people have got to be aware of those opportunities.
Thank you. Farah.
Okay, from a nursing point of view, I think NHS should improve the services from the time a patient is admitted into hospital to the time they are discharged. The whole process needs to improve, because you find most patients in hospitals, they come in and they're medically fit within no time. But for them to go back into the community and be community nurse, that takes a long time. And that's improving the services for intermediate care and working with the social services.
Okay, so those are things that we think would work better, or we need to do better. Let's take a step back or look at it from a different perspective. What are we doing wrong? What isn't working at the moment?
We've made massive improvements with the way we work together, but there's still a long way to go. Recognising where different professions overlap with each other and can help each other out.
So what can we do better to prevent people becoming unhealthy?
I think there's a lot of great schemes on at the moment, like they're doing, especially in Birmingham, like the Be Active scheme, where it's trying to get people into gyms and swimming pools for free. And this is fantastic, especially as students. I know that this has gone down very well. We've been able to spread this by word of mouth, and it's a way that people can really easily get involved and start kind of improving their health.
I think engaging with different companies and businesses and occupations is really important, because that's where people are spending the majority of their time. That's where they're putting the majority of their focus. So if their workforce supports their active lifestyle, then those kind of things are going to have real effect on the society, more so than trying to squeeze it into free time as well. So it's trying to make it part of your everyday lifestyle, like getting to work. So safe, and working as well with local councils and local bodies to try and make it safer as well. So cycling to work, that there's cycle paths, that there's, you know, safe walking routes for people to take. It definitely has to come from the society as well.
Okay. How can we implement best practice, learn from others, share good ideas? I mean, is this something that you've experienced already?
I think there needs to be development time worked into the NHS, and that might be a problem because obviously right at the beginning you said that we're going to now have less money. We've still got to deliver the services, but clinical staff working at the cutting edge do need to be able to engage with each other, with other professional groups, and they need to be able to share best practice face to face. It's all very well having lots of websites or going to conferences and reading learned papers, for instance, and you do get a benefit from that, but just talking to each other produces better, simple results.
What innovations? What about technology, the advancement in technology, working practices? How do you think that could help improve care?
From a nursing point of view, if most of the equipment is electronic, that saves a lot of time. You find that, like for example, Heartlands and Queen Elizabeth Hospital, they're the only two hospitals that do electronic prescribing for drugs. So it cuts down a lot of time for you to be doing a drug round, and you've got more time to focus on your patients. And also, even interaction with the doctors, you don't have to be running around and chasing around for them. They can prescribe from wherever they are, which improves communication amongst everybody else.
What else?
I think in relation to the feedback as well, for there to be kind of systems put in place for patients to be able to feedback, it would take a lot of the labour away from doing the research. I think if there was a system where patients could access it kind of easily and provide just instant feedback on maybe tick box, so that we could see what numbers are accessing different healthcare, we can see what numbers are happy with that particular service.
I think one of the biggest safety improvements we can make in the NHS is using more simulation, so that students can practice things over and over again. They can make mistakes if they're using simulation dummies, and there won't be consequences. In fact, you can often learn a lot more from making a mistake than you can from just repetitive action with patients.
Thank you very much indeed. So there you have it, the views from our nurses, allied health professionals and student physiotherapists.